started? Okay. I'm Dr. Margolis. I'm a biological dentist from Mesa, Arizona. So, as a biological dentist, we stress the use of non-toxic restorative material. I'm supposed to have a pointer, but it doesn't point very well here, so I can't highlight things, so I'll pretend. Focus on the impact of dental toxins, hidden dental infections, what it has on the overall health of the patient's body. We treat the teeth, jaws, and throat. This is the center of life. If anybody wants to disagree with me, I'd like to see you do that, because if you cannot swallow and if you cannot breathe, what are you? Dead. That's the center of life. So, we look at dental problems that contribute to patients' health or illnesses. The toxicity of the materials. We actually run a blood antigen test called the Clifford test. It's a biocompatibility for dental materials. We look at electrogalvanism. When you have two different metals in a hydrophilic solution, what have you created? A battery? And if you have extra electrons running around your mouth and you're swallowing them through your system, what's that going to do to your basophils, monophils, and all the other different immune cells in your body? It's going to bind them up. So it's going to suppress your immune system. Root canals, very dangerous. Anybody in the room have a root canal? Get it out, but get it out appropriately. I don't have a thyroid today because I had a root canal in my tooth number 3. Rear-ended by a tow truck going 45 miles an hour. I was doing 0, I lost. A lot of health problems. But that tooth number 3 is on a particular meridian, and it affects different organs, like my stomach. If I ate anything, I had gas real bad. My neck went from 17.5 inches to 24 inches in 6 days. I was misdiagnosed with thyroid cancer. I had kidney stones twice that summer. And so that was a lot of fun, if anybody's ever had that misfortune. And then that tooth is also on the breast and parathyroids. Hidden bone disease, past extraction sites. We're going to say or explain why extractions are very importantly done. And hidden bone disease of the jawbone, relationship between specific teeth and illnesses. When my son was in dental school in Oregon, I picked up an x-ray and I gave him and his fellow students and 2 instructors the health history of the patient, just by looking at their x-ray. So another guy brought an x-ray, we did that. So finally, the 4th one that I did, I hit all their health problems. On the 4th one, I said, this guy's diabetic. And the guy says, no, he's not diabetic. I said, no, he's diabetic. He says, no. And he didn't put it in his health history that he's diabetic. I said, first mistake. Do you think your patients tell you everything or know everything that's wrong with them? Why are they there for you or with you? So don't always take what the patient writes as gospel. He went over to the patient, saw them, and the patient, he asked, are you diabetic? He says, yeah, I'm going to a specialist next week. I didn't know you needed a specialist to find out that you were diabetic. So he believed me after that. TMJ, temporomandibular joint, is not a disease. It's a structure. So are elbows, and shoulders, and knees, and hips. It could be dysfunctional, but it's not a disease. Neuromuscular imbalance, one of the first things I love to do, if I ever have the opportunity because I've gotten too busy, is walk a patient back to the operatory. Look at their gait, look at how they limp. You'll watch me limp a lot because I have no left knee. And you'll see many things wrong in the balance of that patient and coordination. And as naturopaths, you really need to see that. Pain syndrome, sleep disorders, unbelievable how many people snore, wake up, they don't get a good night's sleep. But what we're looking at is, could the problem of your health be in your mouth? So, what we want to do is, I want to warn you about something. The American Dental Association or Dollar Association state boards may not agree with the following statement. Removal of serviceable mercury-involved fillings, root canal teeth as a source of infection, connection between teeth and human disease, I warn everybody that these are my opinion. They may not agree. If you come to us, you can always seek second opinions. We do a lot of oral surgery, taking out root canals, going back and cleaning out past extraction sites. We always give you the opportunity to go see an oral surgeon who has no idea what we're doing or why. And if you want a traditional practicing oral surgeon, I really can't recommend too many. My son just graduated from oral surgery at Yale a year ago and has a fellowship. And I still tell him he doesn't know how to pull a tooth. This is a tooth. He gets upset with me, but that's okay. You have enamel, you got dentin, which is the inner part of the tooth, and then the pulp. That's where your nerve, lymphatics, and blood supply come in. Down on the outside of the tooth in the bone, it's called cementum, where the periodontal membrane or ligament connects to the tooth to the bone. And perio means around, dental means tooth, and ligaments hold what? Bone to bone. Thank you. Teeth are considered bone. The purpose of the periodontal ligament is to hold the tooth into place in the bone, in the socket. It gives you feeling without pain. If you go like this, it doesn't hurt, does it? It's not supposed to. But what are you feeling? Very good. Pressure. You're feeling the pressure of the tooth because the tooth sits in the periodontal ligament. So when it goes down, it compresses and then releases when it comes up. It's almost like a plunger that a plumber would use. And that helps move things through the tooth. But the killer about a periodontal ligament is it prevents bone growth. And by preventing bone growth, if you extract the tooth and leave the periodontal ligament in there, will it fill in appropriately? The answer is no. What affects the periodontal ligament? Everything the dentist does. Materials that we use, are they being handled properly? Did the doctor test for biocompatibility? Are the procedures being performed correctly? And then what type of anesthetic? Now, I don't know if you all use anesthetic in any of your procedures, but every procedure I do not use epinephrine. Epinephrine is a vasoconstrictor. So that's going to stop the oxygen and nutrition and waste disposal pathways and properties of the blood going through. When I quit using epinephrine, I found out that the teeth that I did crown preps on didn't die. But if I did crowns and I was using epinephrine, 1 out of 5 or 4 crowns needed a root canal 6 to 10 months later. And of course, it couldn't have been my fault because I'm the dentist and I was trained right. So let's look at 2 categories. When a tooth is extracted, the periodontal ligament either remains in the tooth socket or comes out of the tooth. And the remaining periodontal ligament within the tooth socket prevents bone growth, creating an environment for bacteria, fungi, protozoan, and viruses to live. I can actually prove this through DNA testing. I use 2 labs, dental DNA out of Colorado Springs, Colorado, or I use Fry Laboratories up here in Scottsdale. And we've proven that that's what's there. I used to be able to prove that heavy metals and pesticides would settle in this place, but the company that did that, unfortunately, they were bought out by a company that told them they were going to spread it everywhere, do everything they could do. And then they retired patents and everything and won't use them. So if you guys ever develop something that is patentable, always put in the sale that after 18 months, if it hasn't hit a certain particular level of sales, you get back your patents in full, and they lose the right to use them. Think about it. The guy who sold the company asked me why I wasn't his attorney. So, if you go in and remove 1 to 2 millimeters of bone within that tooth socket, now you're going to inadvertently remove the remnants of the periodontal ligament. You get better healing, less post-traumatic pain, and prevents dry sockets and decreases the possibility of developing ischemic, coagulation, osteonecrosis, dead bone. Here's an impacted wisdom tooth. This gentleman, Li Chuan from Taiwan, he has a PhD in health services and provides many different health services. He's also a medical intuitive. When I have problems on a case that I can't figure out, I'll send him an x-ray, and we'll Skype or call, and he'll tell me what's wrong. He's a really talented guy. So he came to me or called me from Taiwan and said, this tooth over here, down in this area, you can see it, is giving me problems. I wound up in the hospital 3 times in the last month and a half, and they're pumping me up with drugs because I have arrhythmia. And I'm sick, and my heart's not working right. So he said, oh. So I said, go to the oral surgeon and have it out. He says, I've gone to 3, they refuse to touch it, and you can't see it very well, but right in the crown, right here, is where the nerve comes right there. So he came over and he says, well, they told me I could be numb for the rest of my life. I said, I'll tell you the same thing. You could be numb for the rest of your life if we hooked that nerve. But you're going to be dead because you're going to pump you up with the wrong medicine. And he was having problems with that. So we took it out. He came back a year later, didn't suffer anything. And he turned around, and that's what it looked like. So if you clean the bone out properly, the bone will fill in correctly. So, as you just saw in the last video, by doing it right, the Novocaine may work before you grow. And a tooth is a live organ. Dr. Steinman is a crazy guy out of the University of Loma Linda. He developed a dye, radioactive dye, that was so small it would fit in a dental tube, 30 microns. And they did in real life imaging, watching the fluids go through the blood and lymphatics, go through the tooth, through the canal, out the dentin, into the dental tubules, and out the side of the tooth, through the ligament, into the bone. So you can show that it was a dynamic hydrostatic pressure keeping the bacteria, fungi, protozoa, and viruses from entering into the tooth and feeding on the protein. This is a wonderful tooth. Come here. Thank you. And it's alive. You can see the structures that we mentioned, the root, the cementum on the outside, and everything coming in the bone. So he showed that there was pressure, hydrostatic pressure going out. Now when you get a root canal, the blood vessels, lymphatics, and nerves are removed. The tooth, the organ, is now dead. They place a filling material under what they call sterile conditions. And every study shows that they can't clean everything out. The dental tubules are too small. And consequently, the protein that existed in the dental tubules of the tooth prior to the root canal, therapy will decompose and ooze out. Remember I said that tooth, you bite on it, it's like a plunger, and it's pulling it out, but there's nothing stopping the bacteria, viruses, protozoans, and fungi to get into that area and feed. So it's having a feast. So a live tooth looks like that. There's 3.5 miles of dental tubules. The dental tubules are 30 microns. It's hot, and it's dark, and it's moist. And imagine that it's just sitting there. Root canal therapy is the only medical dental procedure that takes a dead organ in the human body, fills it, preserves it for future use and appearances. Can you do that with your lungs? Any other part of your gastrointestinal system? So, you're going to keep, as Dr. or Mr. Jess Clifford of Clifford Testing said, dentistry is the only medical modality that considers it safe and healthy to keep dead, necrotic, infected, gangrenous green tissues or organs in the human body. I had a friend, he was getting sued in Texas, first endodontist filed a complaint with the board. A gentleman came to him, he was 68 years old. His PSA was through the roof, over 200. And the guy said, the dentist, my friend Bill Guerrero, said, take the root canal out. What do you got to lose? He went to the endodontist. He told the endodontist, and the endodontist said, it's a perfectly healthy root canal tooth. Bill took the tooth out the next week. 4 weeks later, his PSA was under 3. And he was living fine. So the guy filed a complaint against him at the board for taking out a healthy root canal tooth. The patient came in and said, I asked him to do it. You have no right to tell him he can't do it. I wanted it done. They charged him $5,000 because he didn't take a blood pressure at the end of his procedure. And the daughter actually tried suing Dr. Guerrero's because her father didn't die and she didn't get her inheritance. Nice family dynamics there. So, you know, you get some weird things. So, when you do a root canal, you open up the tooth, clean out the center, you're going to put a liquid and gutta percha or rubbery substance in there. And once the tooth is dead, there's no hydrostatic pressure from within, keeping the bacterium, fungi, protozoans, and viruses from entering the dental tubules, feeding on the dying necrotic proteins. So, the result, the treatment has destroyed the natural pathways for the tooth to be nourished, and the waste disposed. I like how I spelled waste, it's interesting. Yeah, my waist is a little too big too. Disposal pathways no longer exist. The proteins, amino acids in the dental tubules are trapped now, and they just decompose. It oozes out. So basically, no nutrition can enter the tooth, nor can the waste, I got that one right, be disposed properly. In my opinion, all root canals are time bound. So the result is this little thing. We got a better one coming up here. I do not believe that a tooth should stay root canal. It should be extracted, complete debridement. There are some holistic dentists and biological dentists that think ozone will take care of it. The only problem is you can't clean the tooth out. There's a new procedure coming out in endodontics where the guy will tell you that he can take a laser, clean it out, and fill it up, but it's still empty. And after 18 months, it's been shown that it's as toxic as it was before. So treatment, basically, I have tried everything, but what we do for our patients when we come in, we do a cavitat scan, which I believe is coming up in an explanation soon. I've tried homeopathic remedies, oxygen treatment, and basically what we do is extraction of the affected site, clean it out, and go from there. This next picture is of a gentleman. Jerry Boco is an oral pathologist, just retired, and this was his patient who committed suicide. If you look at all the dark areas in that jaw, that's ischemic necrotic bone. This little pathway over here going along there is the mandibular nerve. Take a look how dark it is. The myelin sheath did not exist. Every time he moved his jaw, every time he put a denture in, anytime he ate anything, it was like taking a knife and jabbing him in the jaw. He couldn't take the pain anymore. When Jerry presented this to the public, this gentleman's wife came to the lecture, and she came up to him afterwards and said, "I want to thank you. I didn't think my husband was crazy." She didn't collect the insurance company's money because he had committed suicide, unfortunately. Don't use a vasoconstrictor. Epinephrine is a vasoconstrictor, not a good thing. I do have it in my office. I've used it one time. A few weeks ago, somebody decided to take aspirin after asking them not to. They didn't tell us until after the extraction was done. So after we did everything, cleaned it out, we had to add a little epinephrine to stop the bleeding or slow it down. But beyond that, it's been 15 years since I ever used it. So that goes there. And then it can be an abrupt situation, or it can occur over a long period of time. Dr. Jerry Boco said ischemic osteonecrotic bone, or NICO, neuralgia, ischemic, induced cavitational osteonecrosis. The pain is coming from the lesion in the jaw. It usually contains dead bone. It is referred to as NICO, osteonecrosis. As the pain is coming from infection within the jaw, is referred to as an osteomyelitis, or an active infection. Pain may occur in the face, head region, body, producing headaches, pain in the eyes or ears. It may also appear as arthritis, fibromyalgia, chronic fatigue, or many other differential unknown degenerative diseases. So it's interesting. I had a gentleman come in, Joe came in a year ago, and he had his right hand like this. So I went to Joe to shake it. He pulled it back and says, "You can't touch my hand." I said, "So why are you holding it like that?" He says, "It's arthritic. I'm in too much pain." I said, "That's interesting. I've never seen that. Why are you seeing me?" He says, "Well, my naturopath sent me over here so you can see what's going on in my mouth." I thought that was a little strange. I said, "Have you been to any arthritis specialists?" He says, 24. I think there's 26 in the valley. He's been to everybody, been on all these drugs. Went in and found out that he had a root canal in his upper right third molar and huge NICO lesions in his wisdom teeth areas. We cleaned those out. 10 days later, we took the sutures out. He came in and he went like this to shake my hand. 95% better in that surgery. I wish it all worked that way, but it doesn't. But it can sometimes do that. So the problem with this is blood flow. And if the flow of blood isn't correct, you're going to have disease occur. And the problem here, and this is where you really need a pointer, to be able to go in and show where the third molars are, and show up the corners, up in the mandible, in the maxilla, and that's where things get stuck. Third molar areas are the areas where the blood is supposed to turn around and come back. It doesn't go that way. In fact, ischemic bone disease has at least 72 diagnostic names. How many insurance codes are related to those 72 diagnostic names? Anybody know? You shouldn't. 2. So when I go in front of the dental board, you sit there and they tell me, well, we don't recognize Nico, we don't recognize this, we don't recognize that. I said, well, do you recognize bone marrow edema? Oh yeah, we have an insurance code for that. And then I said, what about ischemic osteonecrosis? Yeah, we have an insurance code for that. But Nico, we don't have an insurance code, so it doesn't exist. So if something doesn't exist, how do you treat it? Or better yet, how do you charge for it to be treated? It's all a power game. And that's what Jerry did. Jerry Boco is very interesting. He's an old pathologist, but he's also a general pathologist. And he's world renowned. And there was an insurance company that went after him because he developed this whole thing on osteonecrosis of the jawbone. And now it's actually in the forefront because of one drug class. Anybody know what that is? Thank you, bisphosphonates. Unbelievable, destructive drug. What was it developed for? Anybody know? Osteosarcomas. If a person was going to die or figured they'd die within 6 months, this stopped the pain. So unfortunately, you're going to have to treat these women who are being abused by this drug because it screws up your bone metabolism. And now it's not only the jaw that's getting screwed up, but now you're finding hip fractures that don't heal. Not cool. So what do? You go through all the same things we talked about, and then surgical excision of the infected area. We use a 3D cone beam x-ray. It's pretty cool. You can turn the skull around and look through it. And we also use a cavitat, which is an ultrasound. So one of the problems that we have here is figuring out what do you do. You're damned if you do, you're damned if you don't. So you got to choose your doors, and basically just by the profession that you chose to do, and the things that you're going to offer your patient, you have to take a look at. And I always try to bring out something to students. You spent a lot of money to get to where you are. Your time is valuable. Make sure that you have a policy of no-show, charges or no charges. It's up to you what you want to do. But you want to make sure you have a policy to do that. 3D cone beam, of course I left it at the office. Sorry, I won't be able to show you that. But I can show you the cavitat. What it does is it puts a sound wave through the jawbone. It measures bone density. If the bone is dense, it's healthy. If it's not dense, there's something wrong. So if you can imagine the pointer, you can see these little green squares. When you look at the very top, you're looking down and you see green. On the side, it's not diagnostic. You have to look down the middle. And on this right side of this picture, you see the red, and that red shows that it's not dense, it's not good. What time did we go to today? What, 2? Oh, good, we got plenty of time. I hope I don't bore you. So in the dental technology here, what we have is we have braids. And this was developed by Jerry Boco and a few other people. And when you have all this green on the top, that's good. When you have a little braid down here, that's normal. That's not uncommon to see. But when we get to grade 3 and 4, that's not healthy. My blood pressure was only 216/160 at one point. And if I went over to my lower right third molar area, which was extracted when I was in dental school, the oral surgeon, I think, didn't know anything because he left some roots in there. He was a little busy. He had to his golf game, I guess. And so, if I wanted to drop my blood pressure, I would give myself an injection down here on the side, just a little trigger point. My blood pressure would drop. So when I went to Ohio for a West Shanklin, the guy gave us a joke earlier. He took it out and cleaned it up. My blood pressure was even higher, and he refused to give me a shot. And I said, "You don't have any epinephrine in there." So I went ahead. I said, And the next day after my surgery, my blood pressure was 145/80, and now it's about 130 to 120, 130, and the low end's 70, 80, someplace around there. I can live with that. But it was just by cleaning out the third molar areas. Okay, so we did some research papers on the cavitat because we were told by state boards it didn't work. Turned out that in these studies, we found out that in my dissertation it was only 99.6% accurate. How many diagnostic tests are 99.6% accurate that you know of? Very few. You know, it's, for something like that, it is FDA approved, and then disapproved, and then approved. What had happened was the insurance company came in after it was approved. There was a medical board, and they took two groups. One group was on bisphosphonate drugs. The other group was the general public, which was what I did with 5 other clinicians. Out of 1,300 to 1,500 studies that we did on the scans, we found a 25% occurrence rate of NICO. Then they did another group that we didn't know about. Bob Jones, the inventor, his wife was put on bisphosphonate drugs and died as a result of that. And it wasn't the breast cancer that killed her. It was a 95% occurrence rate. Now, I think a 70% difference in the two groups is a significant statistical difference. I don't know if anybody else thinks so, but the machine got the highest rating possible. The ADA found out about it. They appointed a new board to it, decertified the machine, and then after $1 million in attorney fees, they got the lowest possible rating. So the FDA, we have different names for it, but it was an interesting time back in 2000. This is ischemically what it looks like in a diagnostic way in a picture. The myelin sheath will dissipate, and then you can have pain that is totally unexplained. And when you go to a physician and they're looking at you, how many of you guys have been taught to look in the mouth? Okay, what do you, well, Jamie has. I've been talking to the school, coming to clinic, and do a little mini sessions with students to show what to look in the mouth. Because the mouth shows so many things. You look at the tongue. If you see a huge groove down the middle of the tongue, what's the problem? I'm sorry, what person? Deficiency. It's a digestive deficiency. Very simple. What happens if they got scalloped on the side of the tongue? Spleen. You know what else it is? There's multiple things. No, it's a lack of sleep. What happens is if you look at your patients, how many are looking like this? How many look like this? If you have a head forward person, that person's got a problem. Try sleep apnea, breathing problems, structural. I was talking to one of the other students. Young Jew, we met a few years ago at a class called KST, and Corn Specific Technique. It's a chiropractor. I'm actually certified. How you like that? Certified with nuts too. It is amazing how much the patients are out of balance. If you get an opportunity to see this guy and learn his method, it's not expensive to learn, it's not expensive to do, but I will adjust the patient because they come in like this, and they say, I want a perfect smile. Well, if the hips aren't in a good position, and the back and shoulders aren't there, what's their bite going to be like? Where do I put their bite? It's difficult. So we go from there, and we were off base again. All right, over here is what a CAPTAT study looks like. It's a compilation, and at that yellow arrow, this is what it looked like on the x-ray, and the blue arrow. There's a big shadow there. We see that all the time. It's very common, but it's not normal, it's not good. Your bone in your jawbone should look more like this. It's granular, it's solid. That is hollow. And the DNA testing that we're doing now is amazing. Full infection theory, one part of the body affects the other part of the body. When a patient has a heart condition, kidney problem, new artificial joints, or other conditions that may affect their overall health, the dentist has to pre-medicate them before they do an invasive dental procedure. What's invasive? Causes bleeding. So if you clean somebody's teeth, that's an invasive procedure. I cleaned some guy's teeth and he told me that he took his medication. He lied. He wound up in the hospital the next day because of the bacterial infection to his heart. Almost died. I asked him